Well, good evening. It's a little smaller crowd than Admiral McRaven. And I told Dr. Abreo, I said, you have a really tough program to follow, but he's going to do his best. I'm going to tell you a little bit about our speaker and his dental assistant. We have Dr. Viren. Okay, Viren Abreo here, who is a dentist that's been in Austin for the last 3 years, and he actually does all the dentistry. Most of them, they're a general dentist, or they're a periodontist, or they're an implant doctor. He does it all, which is wonderful because he really gets to know his patients. Now, he was born in Kuwait and lived in 5 different places before the age of 5. So he's probably lived in a dozen places since then, but he doesn't remember those early places. So we're very fortunate to have him, plus to have Sarah, who's his dental assistant, has come here, and she's kind of excited about things. A couple things with her is she trained as a dental assistant during COVID, and so she's always worn the mask and the glasses and all of the PPE, so she doesn't know any different. All the rest of us had to learn it as we went through it. And Sarah is getting married in 4 months, so she's excited about that too. And we're thrilled to have them come and talk with us and take questions from anyone here. And then we also will share this with everyone on our in-house video, so more will see the presentation. So please give Dr. Abreo and Sarah a warm welcome.
Good evening. Dr. Abreo, as Debbie said, really appreciate you having me. Dentistry is a really wonderful profession, and I'm just blessed and overjoyed to be in it. I tell all my patients, it doesn't feel like work when you're passionate about something. So every time I go in, it's never a dull moment. There's always something to look forward to. Today, I just want to keep it simple. Dentistry can be very niche, it can be very complex. There's a lot of different aspects to it, but I always tell my patients, what can you do to make your routine within 5 to 10 minutes replicable and easy to understand and easy to do every night, and really consistency is the name of the game. So with that being said, this is our practice, Grove Austin Family Dentistry. I was lucky enough to acquire the practice from Dr. Michael Woolwine, my predecessor. He had been doing it for over 40 years. Practiced in the Golden Molar, if you guys are familiar with that. The dentists that built the place were the architects, and there's a host of specialists in the building as well. So I was just telling Debbie that we're all very collegial. We all help each other out. So anything that goes over my head, we all help each other. So that's where we are. We're a stone's throw away on Shoal Creek and 38. So if anyone needs anything, feel free to stop by. Like Debbie said, I was well-traveled at a young age. We weren't in a military family like Admiral McRaven, but I was born in Kuwait, and we traveled around the Middle East before settling in New York, and then ultimately moving to Texas at the age of 11. I cut my teeth, so to speak, at the University of Texas down the street. Went to dental school in San Antonio, and was lucky enough to get accepted into a GPR, which is hospital-based residency, which really helps you get good insight into treating everyone holistically, because the mouth, they say the eyes are the window to the soul, and I beg to differ. I think it's the mouth. The mouth really gives you insight into who a person is, how they've lived their lives, any systemic issues they may have, any oral health problems, in particular hypertension, diabetes, heart disease, a plethora of systemic issues. And I always say the gums are the proverbial canary in the coal mine. So if you keep the gums healthy, everything usually follows suit. You know, the bone sets the tone, but the tissue is the issue. So if you keep everything healthy that way, and you'll see today, you know, Sarah's excellent. I completely forgot to introduce her, but she's been my trusty sidekick for the last year and a half, and she and I tag team a lot of these cases, but she's really responsible for oral hygiene instructions, and we all kind of are an extension of each other. We echo each other, and we try not to sound like robots, but really dentistry is customizable. What's true for one person is not always true for another. So with that in mind, I'll get started here. So why is oral care important? You know, a very renowned dentist said, good dental health not only protects against gum disease, gum inflammation and tooth loss, but can also protect against many other age-related diseases. Truth be told, I mean, we're seeing inflammatory factors and links to Alzheimer's and a host of other things that we didn't know were possible, because the same inflammatory factors that are in your mouth travel throughout the body, and they touch the bloodstream. Is, whether we like it or not, touches every organ and touches every part of the body, but it manifests in the mouth. So that's incredibly important to keep that in mind. So what is the crux of what we do? What is our North Star, so to speak? Where do we start? Because as I said before, dentistry can be incredibly overwhelming. You know, if you have a toothache, that could be something that's completely unrelated to another oral health problem. Or you could have a tooth on top that seems like it's hurting. I can't tell you how many times this has happened, but it's really a bottom tooth, or a tooth across. So checkups and cleanings are paramount, you know, because if you're able to catch these things before they get to a point where they're debilitating, then you're preventing a host of other issues. So I always advocate at least coming in once every 6 months. A few other folks need a little bit more TLC, so I tell them come every 3 months, 3 or 4 months. That one extra cleaning year really boils down to an ounce of prevention is worth a pound of cure. And I can't overemphasize that, because it is a truly slippery slope. Once you lose a tooth, you tend to overcompensate on another side. Many of you maybe have felt this. I know personally I've experienced this. It's just like anything else, any other part of your body. If one tooth is bothering you, you tend to overcompensate on the other side, and then that tooth starts to hurt, and then you lose another tooth, and it just doesn't end well. So, like I said, you know, preventing cavities and gum disease is crucial, and that ties into our oral hygiene routine. Cleanings being beneficial. Plaque is, I'm sure many have heard of this, but on a very fundamental level, think of it as like a biofilm or a thin layer that clings to the teeth after you eat. We have saliva in our mouth that buffers and neutralizes acids, but what it also creates is a thin biofilm. That biofilm, when it calcifies, turns into tartar, or what we call calculus. So when that calculus forms, it's incredibly difficult to remove it with the tools that you have at home. So the key is to prevent that from starting. If you can get rid of the biofilm prior to that, that's going to be the most beneficial, which is why coming to see our hygienist or myself to help with that is really, really crucial. And, you know, not to be a broken record here, but, you know, the bacteria in your mouth travels throughout your body, and really we can do oral DNA testing and test for factors in the mouth that really relay to us what's going on systemically, and hopefully preempt a lot of these issues before they even begin, or at least diagnose them and get a handle on it before it gets to the point of no return. So what do we do when we first see you? Obviously, we want you to be excited about coming to the dentist, so we welcome you with open arms. I think dentistry is probably, if not number one, number two on everyone's phobia list. So really, I think providing a caring environment, an understanding environment, really we come from a non-judgmental point of view where you don't know what the pre-existing conditions are and what people's level of education is. Unfortunately, in my experience, a lot of it boils down to, I can't tell you how many times I've heard this, oh doc, I went to a dentist and I got traumatized and I just never wanted to go back. He put the fear of God into me. And I've heard that story in one way or the other hundreds of times over and over. So really, we try to open our arms and just welcome everyone that comes through the door, and really diagnose on a very personal level, take a tailored approach to what you need, you know, and it's comprehensive in the sense that you always want to, I've always learned this, take care of the crying baby, take care of the most important thing first, but then get back to a routine that we can replicate and be consistent with. So we try our best to be as conservative as possible. Sometimes because these issues are so intertwined, you're not just putting out one fire, you're treating the whole mouth. And it's not, it's tough to negotiate just one or two teeth. You have to kind of get the whole mouth clean. So I think mostly if you're able to keep yourself out of pain and keep decay at bay through fluoride and stuff that Sarah will go over in just a bit, some of these issues are less prominent, and you have to be worried about it much less. So these are, generally speaking, once again, I'm not dogmatic about it. Everyone has their own approach. Some folks brush first, some folks floss, some don't floss, but they brush. I'm less dogmatic about the implement. I'm more dogmatic about the technique. So I have patients that use their manual toothbrush for 20, 30 years and impeccable hygiene. And then I have others with an electric toothbrush. It's the fanciest toothbrush, but it's not being used properly. So the key is, no matter what you use, realizing how to use it for your mouth and to customize it and tailor it to your sensitivities and what your comfort level is. By and large, this is kind of a rough outline. You know, Sarah will delve into it in just a bit, but rough outline. Water flossing, we have a demo here. It's fairly new. It came around about 20 years ago, but didn't become popular until the last 5 to 10 years. That usually precedes flossing, you know, where the gold standard is getting a piece of string floss, getting in between the teeth. That's where you can really negotiate and navigate the corners and the spots that are difficult to reach that maybe the water pick may miss. Brushing is obviously the most important thing at the very end to remove the biofilm that we discussed, prevent cavities and decay. And mouthwash typically for me is optional. If there's gum bleeding, if there's discomfort, if there's an issue with poor breath or halitosis, that's an adjunct to everything else. But sometimes if the mouthwash has less fluoride than the toothpaste, we recommend toothbrushing last, and that's the last thing you do. Keep the toothpaste in your mouth, let it seep into the teeth, spit out or expirate the excess, and let the fluoride really seep in, because you are diminishing or diluting the effect of the fluoride if you're using a rinse or a mouthwash at the very end. But the caveat to that is, if you have gum issues and you have bleeding or poor breath or any of those issues, then you want to finish with a mouthwash. So I hope I've given you guys a good introduction, so Sarah can take over and go over a few things here.
Can you hear me? Okay. So a little bit about me. I got into dentistry because of my own personal experience, having a lot of crowding and crooked teeth as a child. When I was a teenager, I kind of didn't want to smile in family pictures because I was conscientious about how my teeth were. But they took me to the orthodontics, and I also worked with an oral surgeon. They were able to remove all 4 of my wisdom teeth and 4 premolars, so 8 teeth out in one day. And then once I healed from that, they were able to put me into orthodontic braces, and then I had those for about 3.5 years. So now, today, I have a beautiful smile, and I love that, and it brought me back my confidence in my smile, and so I kind of wanted to do that for other people. So when I was thinking about my profession, what do I want to do with my career, I wanted to get into dentistry so that I could help other people and have a job where I felt like I was making a difference every day, and where I could work with people, and I'm also a people person. I love to talk, so kind of all works together, but I wanted to get into it so I could bring back people's confidence and their smiles. And I can't describe it, like when you do, say, a full mouth reconstruction, and this person comes in with broken teeth or crooked teeth, and you know they're in tears, maybe they don't feel confident, and then you're able to work with them and reconstruct their whole smile, and the moment they look in the mirror, they're like, wow, like I'm happy again. Like, it brings me joy to see them smiling and loving their new look. So that's kind of why I got into dentistry in the first place. But back to what he was saying, I work very closely with him as his dental assistant. Aside from that, I am part of the charismatic part of the team that makes everybody feel welcome. And we want to provide the best customer service that we can for everyone and help them to have a good experience where they feel comfortable with the dentist and they feel like, oh, I'm talking to my friend or my family, you know. And that's something I would have to say about Dr. Abreo. When I first met him and was interviewing with him, I just felt like he was different than a lot of other dentists that I had met or worked with in the past. And he has a way of talking to people like they're his family and they're his friends. He's not up on a pedestal like some doctors. He keeps it humble and, you know, just is there for them. So without further ado, next slide here, we're going to go into water flossing. So we have several little demos here which you can come and take a look at the end. This one here is probably one of the most popular ones because it's smaller. It doesn't have this whole big reservoir that you have to put on your table. And you can take it in the shower and go to town on it. So you just kind of trace with these little picks. This one I think is the best water pick insert. They come with these little attachments, and this one is pointed. So you can kind of go down and trace your gum line. And this one is great also. But we recommend them for sure as an adjunct to flossing, not to replace the string floss or floss picks that you might use. But they really flush out bacteria and things that are underneath the gum line that you can't get with your toothbrush or your other floss. So for first-time users, if you've never used one before, you might have to start at a lower setting, especially if you have more sensitive gums. And over time, as your gums get used to it and you get strengthened gums, they will increase the pressure. You can turn it up just a little bit to something that feels more comfortable. Obviously, the higher the pressure, the more force it's, you know, pushing everything out of your gums. But we recommend that you use water, warm water. If you're wanting an additional boost, you can also use an alcohol-free mouthwash in your water flosser. Just make sure the ratio is like 1:1. And then finding the right tip is kind of what I was referring to before with these. There's all different kinds: precision, plastic seeker, orthodontic ones, and the pickpocket. So this one is the pickpocket, which is the one we usually recommend unless you're, you know, in orthodontics or other things. That's mostly about the water picking. We're skipping that one? Okay. And then steps with using the water flosser in more detail is you'd fill the reservoir with water, and then you would select the best tip for you, set the pressure, and then you kind of lean over the sink, or if you're in the shower, you don't have to worry about that. But put the floss pick in the mouth, turn on the water flosser, and then you keep your mouth kind of partially closed to allow some of the water to drain out, but not too open so that you don't make a mess. But with the soft tip, like this one, you can touch your tooth and kind of keep it at a 45-degree angle where the tooth meets the gum, and gently place that underneath the gum line into the pocket. So you just kind of trace around it, and you repeat that process through the whole mouth, top and bottom, inside out. Depending on the model that you have, like this small one, you might have to refill as needed. And then moving on to flossing, we really like this gum brand of floss. Some of them are Pro Weave, which means it's a little bit thicker. It wicks moisture, so any saliva that you have in your mouth, it will expand a little bit, so that'll help you thicken the floss and get in there to bride a little bit better. On the other side, you see Dr. Tung's Smart Floss. This one is really excellent. It's a little bit thicker, higher quality, and it also is really good for your gums because it's waxed in cardamom, which is a natural flavor, but it's very good for sensitive gums, and it's soothing. So you'll take about 2 feet of string floss, if that's what you're using. You wrap it around your middle finger of each hand. Make sure that it's wrapped lightly so you don't cut off circulation. I'm definitely do that all the time to myself. Grip the floss between your thumb and your index finger, and then ease it gently between each tooth so it reaches the gum line. I always think of like a little shimmy shimmy. That's what I do to make it not too forceful, because you can harm your gums if you floss too hard. But you curve it around each tooth like a letter C. And I think of the teeth like a little pizza on either side a go. And then you slide it up and down, shimmy, shimmy. And then brushing. Use always fluoridated toothpaste. If you are like allergic to fluoride or any other things, you don't prefer it, then there are other options. But fluoride is what protects your teeth from cavities or decay. It also will strengthen the tooth's outer surface, which is the enamel. And then the bristles, you want them to go to the gum line, same thing, 45-degree angle, and use small circular motions. If you're using, especially if you're using a manual toothbrush, if you use an electric toothbrush, you don't have to move it around as much because it vibrates for you and does most of the work for you. So don't scrub back and forth too hard, very light pressure to prevent recession or damaging of the gums, which means the gums pull away from the tooth. Brush on all sides of the tooth, outside, inside, biting surface, 3 to 5 seconds each. With the electric toothbrush, I would say just let it sit there and slowly glide from tooth to tooth. You can think about kind of massaging your gum line. That's probably going to get the most plaque off for you. And then brushing your tongue is also very important. That's where we get a lot of our bad breath or halitosis from. And tongue scrapers are always really good as well for gently scraping away that bacteria. Then we have our mouth rinse. So we really like this brand Closis. It's very non-toxic ingredients. It's alcohol-free, so it doesn't dry out your tissues too much. That's something that they've realized the last few years, that the Listerine brand, they have an alcohol-free one now, but the ones like that have so much alcohol really drying out people's tissues and gums more than they ever should be and actually causing other issues. So this one is great. It comes in a mint that I really like, and then unflavored as well if you don't like flavoring. But having your clean teeth first and then using the mouthwash last, like he was saying, it's better to do it that way, especially if you are focusing on your gum health. That way you're not rinsing off anything. And then we want it to be antimicrobial and antibacterial, but whatever you like to use as long as it's alcohol-free. And then avoiding the mouthwash with alcohol, making sure you're rinsing for at least a minute is important, and then leaving that residue all night on your gums. Another tip would be staying hydrated, drinking lots of water. Saliva plays a big role in rinsing away all those food particles and neutralizing harmful acids that we get from coffee, tea, red wine, energy drinks, anything sugary. Staying hydrated also reduces the risk of dry mouth, which can also lead to cavities. That kind of goes back to the same thing of wanting to keep your mouth hydrated. Healthy diet also plays a big part. Cutting back on sugary snacks or beverages can significantly lower your risk of cavities, improve your dental health. Regular visits every 6 months or more if needed can really help catch problems early, maintaining your overall health. And then replacing your toothbrush or your toothbrush head if you have an electric one. You can do that every 3 to 4 months. If the bristles become frayed, a lot of the bristles nowadays, they'll have a color on one strip, and then when it turns white, that's when you know that you have to change it. So that's the main stuff. We can do a Q&A now. If you have any questions, feel free to ask us. And then we have goodie bags up here too. Everybody can come grab one. Got all the things for you. Pass it off to you.
Okay. Thank you, Sarah. And thank you everyone for having us. We've got some goodie bags with toothbrush, toothpaste, floss, the whole nine. And hopefully this presentation was helpful. Any questions?
Sarah, I noticed that there was a big selection of gum, the waxed floss, but they were all different colours. Was that significant?
Yes, so the different colors are for the different types of gum floss. There's a Pro Weave, that's the purplish blue one. That's the expanding floss. That's better if you have looser contacts, if you're trying to debride a little bit better. And then the green one is the thin mint one that's waxed. And then there's also a third one. We don't usually use that one, but the Dr. Tongues as well is really great.
If everything is waxed or none?
It depends on your contacts. I would say each person's mouth, like you said, is different. So if you're someone with very tight contacts that shreds all the floss, then I would say definitely you need mint waxed floss. But if you're somebody that has a little bit looser contacts, then something else should be fine.
Probably don't need that. So, we all know the debate about fluoride in water. And you're talking about a topical fluoride treatment. And my question is, how does that really differ? I think of fluoride in water as being more systemic. It's going to be available when the tooth is being formed. And how good is, say, a fluorided treatment or toothpaste or whatever? I mean, because you're applying it to the outside, it seems like it's when the enamel is formed that is more important. Both of them are great, but.
Yeah, definitely. So with the instructions that we're using for the fluoridated toothpaste, you definitely want to let it sink in. Like at the end, like I was saying, you'll brush your teeth and then you spit the excess. You don't rinse with water, but you leave that residue of fluoride to sink into your enamel, because it will absorb.
It really will?
Yes, yes, and that's what we recommend for anybody who has cavities or is prone to cavities across the board. People that are really prone to cavities, like sometimes they have to come in and get an actual topical application of fluoride at their appointments. But for those of people who don't like the fluoride, you know, there are other options like nanohydroxyapatite. That's something new that's come out. The doctor can tell you a little bit more about that.
Yeah,
Guys do blood pressure.
yes. To your point, when we brush our teeth, we're debriding all the tartar and the plaque, and we're opening up the tubules of the tooth. Think of those as little pathways to the nerve of the tooth. So what the fluoride does is it fundamentally changes the hydroxyapatite structure of the enamel. As we said, the enamel is the strongest substance in the body. Just let that sink in for a second. The strongest substance in the body. When it gets acid on there and the bacteria gets metabolized, those acids eat away at the enamel. What fluoride does is it fundamentally changes the hydroxyapatite structure to fluorapatite, and that fluorapatite is much, much stronger and denser than the hydroxyapatite structure. So to Sarah's point, if there are anti-fluoride people out there, which is totally okay, nanohydroxyapatite toothpaste works in a similar fashion. It's not the gold standard, but it's an adequate substitute if you're not if you're opposed to fluoride.
I'll ask another question.
Go for it.
I would imagine you don't. I'm sure you're not too fond of people drinking carbonated beverages, whether diet or non-diet, right?
Correct. I get that question all the time. Doc, you know, the Waterloos, the seltzers, there's no sugar, there's no issues that way, but the carbonation and the acidity is the issue. When those acids get metabolized, that's what's eating away at the enamel, to our earlier point, opening up the tubules of the teeth, creating those defects and deficiencies. So a simple rule of thumb, and I like to keep it very simple. If you're gonna drink or eat anything acidic or sugary, coffee, tea, red wine, green juices, any of those things, we all have our vices. Rinse out with water. Hydration is key. You don't have to always limit your intake. It's more about neutralizing everything and making sure your salivary flow is adequate, because there's a host of medications out there that also diminish your salivary capacity, which limit your ability to neutralize these acids and liquids.
Being a coffeeaholic, I wanted to ask you directly, specifically coffee, either caffeine, decaf. What is the impact on teeth, and what would you recommend to someone loves coffee.
I'd say it's not the end of the world. Do it just like everything else, everything in moderation, including moderation. So when you drink your coffee, have a glass of water, have a bottle of water next to you, take a sip of that,
Okay.
try to do 1-to-1, and think about it, it's the frequency, not the amount. So what does that mean? If you're constantly sipping your coffee for 8 to 10 hours throughout the day, maybe less, 4 hours, that's more harmful in theory than drinking it in one fell swoop. So if let's say I gave you a can of juice, if you're sipping it throughout the day, it's a constant barrage of acids and sugar on the teeth. Your mouth is not getting a chance to neutralize those acids because of the constant barrage. Whereas if you gulp it in half an hour or 5 to 10 minutes, that's much better. So it's the frequency, not the amount.
You just killed him.
So sorry to be the Debbie Downer here.
Yes, I still live
drink-
with
Drink a
it.
lot of water now.
Exactly.
So you're saying when you brush your teeth, you're not supposed to rinse that out with water?
That's correct. So the paradigm has shifted because think of the toothpaste and the fluoride as medication. And if you're using that medication, if you rinse out right afterwards, you're diluting the effect of the fluoride, right? It's the opposite of what you want to have happen. So keep the toothpaste, and no one's saying you have to sleep with a smear layer of toothpaste on your teeth. Spit out the excess. If after 5 to 10 minutes you're still a little uncomfortable, feel free to rinse out. But my recommendation is try to keep that toothpaste on for as long as possible. And to the point earlier, if we apply topical fluoride in the office, you want to keep that on for at least 30 minutes. Let that fluoride seep into the teeth, undergo those chemical reactions, and strengthen the enamel in the teeth.
That is such good information that I had no idea. Better late than never.
Yeah, and I definitely had to retrain myself in the last year or two to not rinse with water, because that's how I was raised too. I know it sounds crazy because that's how we were all raised, you know, rinse out with water. But leaving that residue on my teeth has helped me actually with reducing my sensitivity, along with using a special toothpaste that he prescribed to me called Prevident. So if you are somebody that has a lot of sensitivity or enamel loss for whatever reason, you can get a higher strength fluoridated toothpaste called Prevident. And my trick would be to put a little dab on the tooth in question that's really sensitive. Let it sit there for a good 10 minutes and sink in, and then brush it off. That's a little free tip for you.
What was the name of the medicine?
Prevident, but it's a prescription. It's something a doctor has to prescribe for you. You can't just get it over the counter.
It's Prevident, 5,000 Prevident.
That relates to something I was going to ask. I use Sensodyne for enamel and have a periodontal problem. Are there any contraindications for any of that toothpaste?
No, Sensodyne, I'd say the Prevident 5000 is considered that Sensodyne on steroids. So if you want a stronger, more industrial strength toothpaste, I'd prescribe you something. But Sensodyne's a great toothpaste to, once again, desensitize, help with the gum health, help prevent inflammation, remove plaque, so on and so forth.
What about periodontics? Because that's what my dentist has prescribed, because they try to cut down like, I've got good teeth and I got even room for wisdom teeth and all that, but I lost 3 in the front because I had, because the 2 of them had roots decay, and give them another one so I wouldn't have to have the space in the middle of the mouth up front. But that periodontics, and I go every 3 or 4 months now, because I've got kind of an acid in the mouth. It stops the decay, but it still can scrub at the gums after a while. I'm getting older and diabetic, but I've been lucky in a lot of ways. But that periodontics, because that's what they suggested. It's over the counter, but for my special case.
Yes, Parodontax has a couple of special ingredients in there that help with your gum tissue. So if you do have periodontal issues, it'll help soothe those areas. if you're having more tooth sensitivity and decay issues and issues with acidity, GERD, any gut issues, GI issues that are causing more acids in the mouth, I'd suggest either Sensodyne or the prescription Prevident 5000.
Well, that's right, but these are over the counter. I didn't have a formula, but they suggest I use just this one.
Yeah, and once again, it's more about how you use it. If it's working for you, stick with it. But to our earlier point, if you're able to just keep it in the mouth and almost bathe the teeth in the toothpaste and the fluoride, that'll help keep the teeth from getting cavities and decay and sensitivity.
Right, but the only places were in the front because that's where the acid drops in right here, but it bounces off the rest.
Right.
That's where I lost the 2 and then a third they took out so I could have a place to have 3 implants.
One more? Yes. Okay, I have one more question. It's about toothpaste. I was in a store the other day, and I was just surprised at how many different toothpastes there are, and the variety. Well, the range of price, I was looking at one, and it was about a third of the price of some of the others, and I thought, well, is this a marketing ploy? Or is it really so much better, this one that costs 3 times as much?
So there's a myriad of options there, and it's all up to using what works best for you. To your point, there's some companies that market better than others, some that have additives in there, some that market themselves as anti-fluoride and cater to the folks that are against fluoride. So I would keep it very simple when you're looking at the ingredients list. You want to make sure there's fluoride in there. If you're concerned about the teeth and the way they look and the color of it, you can have like an Arm & Hammer whitening or Colgate whitening, but you can't go wrong with Crest, Colgate, and Arm & Hammer whitening. And Prevident and Sensodyne are excellent if you need something more robust.
What about baking soda?
Baking soda is great. It's great. It's great. Yeah, it's excellent for teeth whitening.
Yeah, I use it once a day, and then toothpaste the other time of day.
That's actually what I
Makes my mouth
suggest
feel
too.
so clean.
Right. If I prescribe a toothpaste and you have a favorite toothpaste that you prefer, I say use it in concert, meaning use your favorite toothpaste during the day and then use the prescription toothpaste at night. So you're getting the best of both worlds. If the toothpaste at night is more effective and beneficial because that's what's really providing this fluoride and providing the desensitizer. The one during the day maybe for whitening or for other uses, maybe the gums more so than the teeth.
And while we're on this subject of toothpaste, I will say do avoid the charcoal toothpaste. If you are into whitening your teeth, those ones are not good because what they actually do is they remove the enamel or outer surface of your tooth. It'll look whiter, but for a while, but once you remove the enamel, then you have a lower layer that's more yellow. So avoid anything with the charcoal in it because that's way too rough on your teeth and your gums.
Thank you so very much, and I have to thank Donis Hazelton for bringing us Dr. Abreo and Sarah, and so appreciate you coming. I know everyone has been presented adequately today, all day long, so thank you so very much for coming, and thank you for your presentation.
You're very
Thank you for
welcome.
having
Thank you for having us. Thank you.
And we have goodie bags up here. Anyone that wants presents, come get your